All right, scholars, here is your next paper. It is another brief report, but I think this one will give you a bit of a different flavor than the other research studies we've already gone over. Um, and again, I will link this in it. So here's the abstract. It's a bit of longer, different laid out, different organization, no problem. But they do cover the objectives first to evaluate the impact of counseling regarding the maternal effects of lactation on pregnant women's intention to breastfeed. So they're really trying to understand, how did our counseling support, hinder, help women who already intended to breastfeed to actually breastfeed? What happened? So how did they do this? Methods. The methods is always the how did they do this? So for women seeking prenatal care at an urban university hospital, they completed a survey, completed surveys before and after receiving a 5-minute counseling intervention regarding the maternal health effects of breastfeeding. Now, you might be asking yourself, 5-minute counseling intervention, right? Because when you're reading this sentence, you can already see that there is some background information that's sort of driving this method, right? Okay. So then they go on to tell you that the counseling was delivered by student volunteers using a script, and that participants were asked the likelihood of breastfeeding affects maternal risk of multiple conditions using a Likert scale. They compare their pre-post changes and knowledge scores. Now, what did they do? They used a paired t-test. Statistics, so this is going to have a lot of numbers in it. They used a paired t-test. They also did a multivariable logistic regression, another statistical method. And that method specifically was used to examine the impact of the increases of knowledge on the participants' intention to breastfeed. So they have two types of statistics already, at least. One, they both involve the pre-post test. One is looking at the individual responses and providing a summary score. And the second one is to see if that score is connected to women's intention to breastfeed in an increasing sort of way. Here are results. So they had 65 participants. The average age was 24 with a plus or minus of 6 years, which means they could have been 30 or they could have been 18. 72% were African Americans. 9% had college degrees. Half of the 65 had previously given birth. Good information to know. And yet 21% had fewer than 21%. Few or 21% had previously breastfed, which means that this is a group of women who I would say the majority have had some breastfeeding experience, but you never know how that experience goes, because if you've had a negative breastfeeding experience, you might require a little bit more counseling to help you to understand why that was and what's happening. Okay, so now they go into some more details. Before counseling, they are aware of few were aware of the benefits of lactation for maternal health. And one of the arguments that is happening in the literature is whether or not you need to understand the benefits of lactation in order to understand why you should breastfeed, as opposed to a doctor recognizing that from a biological standpoint, breastfeeding contracts the uterus, which reduces the postpartum bleeding, which is necessary so that you don't have postpartum hemorrhage and need a blood transfusion. So there's the biological and there's the social aspects, and some research is going in both directions. Total background knowledge that I already have, but you will gain some of that when reading these articles. All right, so now they talk about after counseling. What they found is that the average knowledge score, or the mean, improved from 19 out of 35 to 26 out of 35 with a p-value of less than 0.001. Now, this is the p-value. P-values are intended to be able to say that something is or isn't statistically significant. Now, what would have been nice is if not only did they include the p-value, they included the effect size, because the effect size then will tell you not only does this matter, how much this matters. And so but it's not a ding, because scientifically we always just like to include the p-value because we think it has more meaning. We've attached more meaning than what we should have. But that's just how statistics goes. Okay, so then they also talk about the improvement in knowledge score was associated with the increased intention using the adjusted odds ratio. Remember from the other article, we talked about the odds ratio. This A says that this is the adjusted odds ratio of 1.20. Uh-oh, I'm running out of battery power. Okay. For confidence interval ranging between 1.02 and 1.42. All of these numbers are just telling you where something is or isn't falling. And they're saying that the odds ratio of the increase of intention to breastfeed based on your knowledge score is somewhere between here and here. As well as wanting to breastfeed is between here and here. And a higher odds ratio is good in this case. All right, so they gave you all of that. And so now they talk about the conclusions for practice. And of course, brief structured intervention or counseling can increase. So you have now gotten a good layout of this article. This abstract gives you a lot of information. And so now when you can read it now further to want to know more. So there's a few things I want to point out that are different here than I didn't point out before. So here is the supplementing information. So I don't know what the supplementing information is, but they're telling you, we're giving you more information relative to this. It could be data, it could be studies, it could be all sorts of things. I'm sure it's data, because usually that's what the supplement is provided. Now, they jump in with the significance, as in what is already known on this subject, which is very helpful to give you that quick information to be able to say, well, why is this a problem, or what is the problem? And they do that before the introduction. Great. They also concluded with, what is the study add? Okay, so you gave us what is the beginning. Now, what is the study add? This adds that maternal health benefits of lactation increase infant feeding significantly, because breastfeeding is really important part of the reproductive system, is part of the reproductive cycle. We don't talk about that. It is helpful in preventing postpartum hemorrhage and a whole bunch of other things for the woman and the child. Again, things that are not discussed except in the literature, it seems. So now, if you want to learn more, then you can read through the introduction, and the introduction is going to give you lots of research. And notice that all the blues are dates, and so those are all definite research studies that they're pointing back to within what they're saying, and why. Then they go into the methods. Again, where did they get this information? They tell you it's IRB approved through the University of Pittsburgh. They tell you that it's a maternity hospital in Pittsburgh. So they're giving you a lot of information to make sure that you can situate this study geographically. Why is that important? Because a study situated, say, Charleston, South Carolina, even if they repeated the study, but it's done in South Carolina, it may turn out and look very different than, say, a study in Pittsburgh. Why is that? Because the healthcare system is different, because the distance between places is different, because the poverty and the capitalism and all of the things are different, because the healthcare systems are different. While we're all the United States, each of these states run their health systems differently, and all of that can matter. So if you wanted to repeat this study, you might have to tweak it for your population. So then it goes on to talk about their structured counseling interventions, how it was developed, which is really helpful information to know, so that you can either use it or, again, tweak it. What information? So then they hypothesize, which is really helpful. And again, they looked at the internal consistency, which is a good mechanism to look at. That is something you want to be able to see if they did their internal consistency or validity, reliability of the study post and pre. So they did do that. That's good to see. They hypothesized that women receiving counseling intervention would increase their understanding of maternal health benefits of lactation and report a stronger desire to breastfeed. No surprises there. They also hypothesized that the likelihood of a woman reporting strong intention to breastfeed would be related to both baseline knowledge as well as change in knowledge. Again, nothing unique about those hypotheses. They're run of the mill. Then they talk about the stats. So they used the t-test for paired samples because they had pre and post differences. So if you read a paper and they used a paired sample, but you didn't see pairs of studies or pairs of surveys or pairs of something, you know statistically they did something wrong. Or you know that you need to go and read a little bit more and see, well, did they do something wrong? How did they use this? Why did they use this? All of those kinds of things. So that we know. And then they talk about the multivariable logistic regression to examine the significance of the impact. So now you get to see that not just there was an increase, but let's talk about what does this increase actually mean for the lactation intention to breastfeed or not. Which is helpful. And then it continues on with others. And then it goes into the outcome variables. So they specifically looked at dichotomized, which means two, outcome variables with the positive intention versus negative intention, and intentions to breastfeed versus neutral or negative responses. Because, of course, neutral is actually negative, no matter what we say. Mm-hmm. Then it goes into the results. I will not walk you through all the results, but I will skip to, oh, that's nice. That's the little, because clearly this is a paper from an actual journal. So now you get into the results. It gives you the table of the participants and who they were, how much college, how much education, who they were individually. Now, what it does not give you, which I think is actually important, is the level of insurance, because how you plan on paying for something can affect your ideas and thoughts about breastfeeding. And you might have to have a deeper discussion on why is that. We'll talk about that. So again, they did a multivariable models. They tell you what's in it. And they looked at, again, odds ratios. You can read that. But I want to point some of these details out. Now, in the discussion, you see some more dates. That's because now they have taken what they have done and now they're talking back to the literature. So that's what your discussion section always is. It's the authors taking their results and talking back to the literature so that you can situate it or house it within the proper scopes of the literature, and they do that. Here's some more tables on what these look like. Again, the star usually means that it's statistically significant, or they only included those that are statistically insignificant. And they did not, because they have at least two that are not statistically significant. This one, oh no, they have three. So this one, difficulty losing weight, which we talked about in another one, they didn't see that here. That's not statistically significant. This one, lower sex and libido drive, which is usually a worry, but it's not, it doesn't need to be a worry. And here they found that it's not statistically significant from pre to post in terms of changings. And is there one more? This one is on the cusp. It's on the cusp. And said that one. And this one is on the cusp in terms of causing headaches. Okay. And again, it gives you the star to tell you the p-value from the pair t-test that were statistically significant, or where did they get that information from. So then your next one covers the three categories: wanting to breastfeed, intending to breastfeed, knowing that breastfeeding is important, and they use the adjusted odds ratio from their logistic regression. So again, it gives you all of that information. So you can always see, what did they say in the narrative? Does it make sense based on the table of research? And that is it. we already talked about the discussions, and the last of it is talking about the strengths, and they usually talk about what more information is necessary, and done. So now you have another paper in your back pocket that has a different kinds of statistical test in it, and it's slightly different. I'm probably going to pull one more so that you get a nice broad flavor of research studies. All right. Oh, I think I'm done here. Stop sharing and hit record, and I will talk to y'all later. Bye.